Two health systems, one hospital. Back in October, Beloit Health was denied its proposal to open the NorthPointe Neighborhood Hospital. WIFR's Nathaniel Langley learns how a partnership with FHN may change those chances for approval.
Opening a hospital anywhere may sound like a great idea, but getting NorthPointe off the ground in Roscoe leads to a unique partnership.
We are committed and put our communities first.
FHN and the Beloit Health System share one goal.
We will be forming and moving forward with the creation of the NorthPointe Neighborhood Hospital.
The two health systems unite with plans to build a $21 million hospital at NorthPointe in Roscoe.
That will make a win-win situation for both communities.
In October, the Illinois Health Facilities and Service Review Board denied the NorthPointe proposal. Beloit now turns to FHN for its updated request.
So I think it organically came together where when Beloit was not able to do this on their own.
To address the board's concerns of excess hospital beds in the Rockford region, FHN would move 10 of its 100 beds from Freeport to NorthPointe.
We really looked at it critically that we don't have that need presently.
FHN and Beloit would together own NorthPointe Hospital, sharing staff and supplies.
Together, if we recruit it, we'll be able to service both communities and have enough volume to keep that surgeon busy.
NorthPointe isn't a merger per se.
But give the benefits of a merger, give the benefits of cooperation.
Beloit CEO suggests the door is open between the two systems.
Who knows what happens into the future?
FHN CEO says even in the pandemic's peak, that health system didn't reach capacity. If a need returns, though, FHN can ask the state for more beds.
Thank you, Nathaniel. And part of the NorthPointe state approval requires a public hearing. That's planned for next Tuesday at the Roscoe Township Community Center. Beloit will return to the board sometime before October.